Here's the issue with root canals that isn't getting spoken about enough. So after a dentist performs a root canal, they remove the nerve so you don't feel pain anymore, but they're also removing the circulation and blood supply. They're removing the immune defense in and out of the tooth, and they're removing any connection it has to the autonomic nervous system. So essentially what is left is a non-vital structure left in your jawbone with no real circulation in and out. Now, that's okay to buy you some time and keep the tooth in your body, but what happens over time is that there's aerobic bacteria that colonize this area. And what they release is toxic. So they're releasing these toxic materials into the tooth and back into these canals, and it's causing an immune reaction and an inflammatory process. Thousands and thousands of tiny little microscopic vessels in every single tooth on the inner part. And this connects to the body, and no dentist, no matter who they are, can actually clean out all of these tiny little microscopic tubes. So to recap, the bacteria are colonizing around a plastic material that we're putting in the tooth, and it's causing a low-grade chronic inflammatory process in your jaw 24/7. Again, with a lot of my patients where they're coming in with brain fog, low energy, autoimmune diseases. So my recommendation would be to get the tooth out, remove the source of infection, place a zirconia dental implant. These are super biocompatible and do not trigger any bacteria or chronic inflammation over time. That's key because you're gonna have this for a long, long time. And I think this is so important because true health starts in the mouth. That's where everything starts. And if you don't have health in your mouth, your whole body won't be healthy. If you're going to have something long-term, it shouldn't be a root canal. It should be a zirconia dental implant.